Heyo. All right. So, as promised, here is the PowerPoint for today. Okay. This is our second of non infectious diseases. Remember, non infectious diseases refers to diseases that are not transmitted from one person to the next, not transmitted in any way from anything to any body. They're diseases that are definitely internal, that start inside the person's body, whether they're born with them or they acquire them over time. Okay, so the next one in this is cancer. Cancer is the name given to a group of closely related diseases that results from uncontrolled cell growth. And you can see that's your first bullet right there. It's a complicated disease, and no one fully understands how cancer forms or why it starts in the first place. But we do know there are some things that you can do to try to limit the chance of cancer happening in a certain individual. Okay, but once again, the important part to take away here is that there's no such thing as the cancer, but a cancer, right? Because it's a group of closely related diseases that result from uncontrolled cell growth. Uncontrolled cell growth. And characteristics of cancer cells: one, the cell growth is uncontrolled, meaning it never stops. Like, imagine your skin just kept growing and never stopped. You'd be covered with so many layers of skin, you wouldn't be able to move your fingers. But your skin growth is controlled because your body has a very specific amount. When it needs more, it makes more, and when it doesn't need more, it doesn't make more. Now, the cells don't function as part of your body, so they're useless. They don't have a function. Skin cells have a function. They cover your body. Okay, blood cells have a function. They deliver oxygen to your cells. In the case of cancer cells, they do not form a function. And so not only do they not form a function, but they actually take up space and interfere with normal body functions. So if they're, for instance, if the cells that were there to, let's say, help a person breathe in the lungs were becoming cancer cells, well, then those cells wouldn't do their job, which is absorbing the oxygen and passing it through into the bloodstream. The cells can travel throughout the body. So instead of, let's say, like lung cells that just stay in the lungs all the time, cancer cells do have a way of sometimes traveling through the body, through some of your body systems, like your bloodstream, like your lymphatic system, which carries like waste materials. And so it can travel through the body and it can go from one place to the other, making more than one area of the body sick. And the cells also produce tumors. Tumors are abnormal growths anywhere on the body. And sometimes tumors can be so large that they can be seen through the skin. Sometimes tumors can be so large that they actually crowd out the necessary and normal cells that are in the area. Like, for instance, a person with a brain tumor, that means that the cells that used to be brain cells are becoming cancer cells, and that tumor is then going to cause the problem in the brain. So, certain regulatory molecules in the body control the beginning and ending of cell division. Now, this is something that you'll learn more about maybe in high school or in college. But basically, um, and we did do some work on cell division, but basically, every cell in the body has a beginning and an end to its cycle, to its life. And so some of them just keep going over and over and over again, and like just growing in size. Like, for instance, muscle cells and bone cells. When you reach the point where you stop growing in your life, well, obviously those cells aren't going to keep making more cells, but they can still, like muscle cells can, expand their size if you're exercising. But there's supposed to be a beginning and an end to it. Now, if the control is lost for the beginning and the end, a mass of cells called a tumor results from this abnormal growth. And we just discussed why that's a bad thing. Tumors can occur anywhere in the body. Cancerous cells can leave a tumor, spread throughout the body via the blood vessels and lymphatic vessels, and then invade other tissues. So even if a person has a tumor in a place where it could easily be removed, if it's not identified early and some of the cancer cells leave there and then go through the bloodstream or the lymphatic vessels to another place, well, then they're going to invade other tissues. And some of those tissues might be necessary, like if they're part of a vital organ. So we'll talk about some types of cancers. Leukemia is the first one. It's a cancer of the white blood cells. And this is a really, really scary and deadly one, because white blood cells, as you guys know from the earlier things on infectious diseases and immunity, white blood cells are responsible for fighting disease. The ones that become cancerous, meaning they turn and now they're no longer useful, well, those can fight disease. And so if eventually too many of them become cancerous and not enough of them are doing their jobs, well, then the person wouldn't necessarily die from leukemia, but the person gets sick and their body can't fight off the disease. And when the body can't fight off the disease, that becomes very dangerous. Things like the common cold and the flu could actually wind up potentially killing a person who has leukemia, while somebody else that's in a healthy condition can fight them off. They also multiply uncontrolled, and they can crowd out red blood cells, normal white blood cells, and platelets, which are another part of and a necessary part of blood. So that would be the crowding out portion of why cancer is so bad. Colorectal cancer, or cancer of the large intestine, is one of the leading causes of death uh, among men and women. And nobody knows exactly why this thing starts. But changes in bowel movement, blood in the feces, stool, poop, these may be indications of this disease. So they're things that can be looked out for. And for most cancers, the way it generally works, and I don't want to make a statement about all people that ever had cancer, but the way it generally works is the earlier it's identified, the more treatable it is before it spreads to other parts of the body. In breast cancers, tumors grow in the breast. The second most common cancer in males is cancer of the prostate gland, which is an organ that surrounds the urethra. Again, no one knows exactly why these things start, but the earlier they're identified, the more treatable they usually are. Okay, smoking, as you all know by looking at this dummy in the picture right here, okay, smoking has been linked to lung cancer. It can cause lung cancer. This doesn't mean everyone who smokes get lung cancer, and it doesn't mean everyone who doesn't smoke can't get lung cancer, but it does mean a person who smokes is more likely to get lung cancer. Lung cancer is now the leading cause of cancer deaths for people in the United States, men and women. So if lung cancer is the leading cause of death and smoking is the leading cause of lung cancer, well, then A plus B equals C? No. But 1 plus 1 does equal 2. So I would be smart and say not smoking definitely limits your chance of getting cancer. And not only that, but since lung cancer is the leading cause of cancer deaths, well, I would avoid smoking at all costs. Exposure to certain chemicals also can increase your chance of developing cancer. These substances are called carcinogens. A carcinogen is any substance that can cause cancer. These are things like asbestos, solvents, which are used in factories, heavy metals, alcohol, and home and gardening chemicals. Now, limited exposure to these things aren't necessarily going to cause cancer. Like, for instance, if you've seen people, and I'm talking about before the pandemic, if you've seen people that work in beauty salons, a lot of times they're going to be wearing face masks and not to protect themselves from germs. But before the pandemic, they wore these face masks because they're surrounded by the chemicals that are used all day long in beauty salons. Now, you walk in there and you only go in there, let's say once every 2 weeks or once a month, and you only sit in there for like an hour. Well, that exposure may not be enough to cause cancer. But a person that sits in there 8 hours a day, 5 or 6 days a week, that could possibly wind up causing cancer. So that would be a reason that those people are wearing masks inside of those things. Exposure to X-rays, nuclear radiation, ultraviolet radiation of the sun also increases your risk of getting cancer. Now, again, walking outside in the sun is not going to give a person cancer per se, but if a person does have a genetic risk, okay, and usually that's people with very light skin like myself, ultraviolet radiation over long periods of time, like things like sunburns and tans, actually can cause the skin cells to start to become cancerous cells. Exposure to X-rays, you might be like, well, there was that summer that I broke my hand or my arm or my foot and I got an X-ray. Well, that's not a big deal. But if you've ever been to a place where a person has got an X-ray, you notice that they still put this really heavy vest on you that's filled with lead over the major organs in your body. And you also notice another thing. They leave the room and they press the button in order for the X-ray to happen. Now, the reason that they do that is because a person who works with X-ray equipment, like an X-ray technician or a doctor, those people are going to be exposed to it multiple times a day, every day. So that would be dangerous and possibly cancer causing. And that's why they leave the room before they do it. Now, you're in the room only one time. I mean, how many times in your life do you get an x-ray? 3 or 4 times? That's fine. Going through a metal detector 3 or 4 times, that's fine. But if you are doing these kind of things every single day of your life, multiple times a day, then it can be dangerous. Ultraviolet radiation, which is radiation from the sun, can lead to skin cancer. So some people have a genetic predisposition for cancer. This means they're born with genes that make it more likely that cells can turn cancerous. So what they need to do is protect themselves against these things, depending on what kind of cancer they may be susceptible to. Surgery to remove cancerous tissue, okay, those are like usually it's going to be a lump or a tumor, right? That's one way. Radiation with x-rays to try to kill cancer cells. And I know, but you just said x-rays can cause cancer cells. Well, the radiation they use to kill the cancer cells, they try to target just the cancer cells. But it's the same reason that people that get radiation therapy, and also this next one, chemotherapy, which is therapy from chemicals, it's the reason that, you know, a lot of times after getting the treatment, they actually get more sick than the cancer is making them. Because although these chemicals and these x-rays are supposed to kill just the cancer cells, they also do affect the healthy cells in the body. And this is the same reason that people lose all the hair on their head, their eyebrows, their eyelashes, all the hair on their body. All of this falls out. And this is because of the treatment from the cancer, not the cancer itself. Chemotherapy is the use of chemicals to destroy cancer, and early detection, as I've said several times already, is the key to any successful treatment, because the earlier you detect it, the less cancer cells there will be. Research in the science of immune processes, called immunology, has led to some new approaches for treating cancer. Specialized antibodies produced in the lab can actually be used as anti-cancer agents. Now, at the time of this PowerPoint, they were being tested. These kind of things are already being used, some successfully, some not. So these antibodies are used as carriers to deliver medicines and radioactive substances directly to the cancer cells. So they're killing off the cancer cells without harming the person. Because sure, you could say, oh, this person has cancer. Let's just put them in a radiation chamber for 36 hours. Well, it'll kill the cancer, but it'll kill the person too. If you can target just the cancer cells, the person has a much better chance. Now, knowing some of the causes of cancer might help you prevent it. The first step is knowing early warning signs. So, I'm not even going to read them because they're mostly gross, but they're right there if you want to read them. Medical attention and treatments such as chemotherapy and surgery in the early stages can actually cure some cancers or keep them inactive, meaning that they can make the person cancer free, at least temporarily, and hopefully the cancer won't come back. Choosing not to smoke, not to drink, these can help prevent mouth and lung disease. Having a healthy diet without a lot of foods that are high in fat and salt and sugar might also reduce your chances of developing cancer, because they say cancer loves sugar. Using sunscreen lotions and limiting, especially those of us like myself that are so light skinned, but everyone can use sunscreen. And limiting the amount you expose your skin to direct sunlight can prevent skin cancer also. Okay, inhaling certain air pollutants such as carbon monoxide, sulfur dioxide, and asbestos fibers is dangerous to your health. Now, on a daily basis, you don't come along enough of these. But if you've ever seen those law commercials where they're like, are you suffering from mesothelioma? We might have a lawsuit for you. Okay, that's because some people that worked in buildings a long time ago removing asbestos, which is a fireproofing material. It's really good at stopping fires, but it turns out when their fibers go into the air, they actually cause people to have cancers, especially lung cancer inside of their body. The people that did the cleanup job after the attacks on 9/11, they were also breathing in a lot of toxins from there. So the Clean Air Act, which is the U.S. government's attempt to try to keep the air cleaner, which of course the Grand Pumpkin attempted to repeal, these laws are intended to reduce the amount of these substances that are released into the air. And so keeping everyone healthier from there. All right, so that's the end of that thing right there. So